Uh,
Hello, everyone. Welcome to the Glow Podcast. I'm here today with a very exciting guest. I have Dr. Joe Pazona here with me. For those of you who are new here, we are Tailored Marketing and we partner with organizations in health, wellness, and longevity space to fuel growth through strategic marketing and sales strategies. So if you are interested, drop a comment below. Dr. Pazona, thank you so much for coming on today. I'm super excited to talk with you. If you would, I would love if you would just go ahead and give a little bit of an introduction so the listeners know who you are.
Thanks, Taylor. Happy to be here. Dr. Joe Pazona. I'm a board certified urologist, and I'm the CEO of VirtuCare. We are a healthcare company that partners with rural facilities to help implement outpatient specialty clinics like urology with surgical procedures.
Awesome. That's super cool. And so, I guess obviously, Virtue Care, how did you kind of come to realize that that was like something that people needed, where these rural areas maybe were struggling more with kind of these, like, more of the specialists and specialty parts of medicine?
I think to understand how I came up with it, I'd like to, if it's all right, just briefly share my story and background and how it ties in, because
Yeah,
it always starts with a story, right?
of course.
And your why for doing things. I finished my training at Northwestern in Chicago, and after 13 years in a big city, I was ready to take my young family at the time and go live in some mountains. So we moved out to rural Washington State.
Cool.
And I really took the job because it just seemed to be a great fit. It was a beautiful community. It was a good place to raise a young family. It was a great professional opportunity where it was a very physician-led organization. And at that time, I very much took the mindset of I'm just going to do the doctor stuff. I'm going to leave all the business stuff to those folks. I don't know anything about it. I don't want to. I'm
Yeah.
just going to be a good solid urologist. And so I went in with that mindset, and a few things opened my eyes in terms of rural healthcare and eventually led me into the Virtue Care journey. Number one, we were the only really referring medical center for several hundred miles. I mean, there were mountains to
Wow.
get to Seattle. Spokane was 3 hours away. And so I started seeing how important access to the right doctors can be and how timeliness matters. So, I share stories of how patients would be sent to me after months of what they thought they had were bladder infections. And it turns out they actually had bladder cancer that was misdiagnosed.
Wow.
And it was just because they couldn't get in with the right doctor quickly enough. So I saw that we've got to solve this problem. The second thing I noticed when I was there that kind of led me to start the Virtue Care journey was when you do hand off all of the, we'll call it the business stuff to non-clinicians, there's a price we pay as clinicians because nobody knows what it's like to be in a clinic taking care of a patient like a doctor. And we have to have a seat at the table. And when you give up that seat at the table, that has long lasting impacts, not only into your quality of life, but even the quality of the care that you can deliver. So it was during this time I started trying to wrap my brain around how can we do this better? How can we do this differently? And unfortunately, I'm not a complacent person. So sitting idle and just coasting for the rest of my career was not an option.
Yeah.
So my journey took me to at that point a job in Alabama to be a chief of urology with this idea that I was going to be able to build a urology department. And ultimately, what looked like a dream job was a nightmare. There was just no alignment. What was promised was not delivered. I was not a chief of anything. I was just an employee.
Yeah.
And so here I was with this idea of I'm trying to build something based on my previous experience. Because again, even in Alabama, a lot of rural communities, a lot of people getting hurt. And we were doing major complex surgeries on patients, and they couldn't get someone to answer our phones. They couldn't get in to see us. And
Wow.
so we met with local leadership and we said, guys, this is not tenable. The situation you described is not reality. Something's got to change. And
Yeah.
I'll never forget this. The CEO of the system looked me in the eyes and said, Joe, we're going to fix this. And they did 4 months later when they fired me. They said, Joe, you're a great urologist, but quote, you don't fit in here.
Wow.
So here I was. I was a urologist who was well respected, brought in to build something, essentially told, no, actually, we just want you to be quiet and be a worker bee. We're running all of this. So be quiet, you're out. And I went to the other local hospital in the city. They weren't hiring at the time. My family now was a family of three children that I was supporting. And there literally was no job for me in the city. And my family situation was such that I was not easily mobile with my children. And so here I was, an unemployed urologist with the ability to help thousands of people throughout the country, and I couldn't help them
Yeah.
simply because of how hard it is for doctors to get state licenses and credentialed at hospitals and enrolled with payers and all the work that is necessary to be a physician. So I was just faced with continuing to move my family around. So I said, Is there a way to do what I do without being in the same room as a patient?" And this was even pre-pandemic, before telemedicine really caught on. And so
Yeah.
it was at this moment where I envisioned a model whereby we can more highly leverage doctor skills and we can live where we want, but care for where patients are needed. So that was the background as to why VirtuCare formed. We've been through some different iterations since then, but I'll at least pause there and say, like a lot of things, you have to go through a struggle and a difficult moment to really develop a strong why to build something.
For sure.
When I'm working on virtue care, I'm doing it for those patients who I don't want to die of bladder cancer.
Yeah.
I'm doing it for the other urologists and other doctors who are living in a place that might be a good fit for their family, but not a good fit professionally, to give
Yeah.
them jobs to work in a fractional way. So that's why I formed Virtue Care.
No, that's super, super awesome. And like you said, I do think too that every good company, every good invention, every good entrepreneur, they all have a specific struggle that they went through. And they're like, okay, I went through this. I know I'm not the only person. And let's do something about it. Like you said, you're not complacent. You're like, okay, I got to find a solution for this. And I'm sure that has helped you a lot. And probably you're like, sometimes I wish I would have just been complacent.
Yeah, there's no doubt. I'm like, what the heck am I getting myself into here? But it's one of those things that the healthcare ecosystem is very broken. I don't think I need to
Yeah,
convince you or any listeners that if you've ever engaged in the healthcare system, how painful it is. In fact,
for sure.
I think there was that South Park episode recently where the kids, there was one line. It's like, I just engaged with the U.S. healthcare system, and it almost killed me.
Yeah,
It if
literally.
South Park is spiffing on it, we know there's a problem. But
Definitely.
I really feel the pathway towards improvement must be led by physician entrepreneurs, because
Yeah.
there is no other profession whereby, first and foremost, no one else can come in and do what I do. I mean, just legally and from a
Yeah.
regulations perspective. Any other business, I mean, the CEO could jump in and do the job of the worker bee with some training and skill to a degree. That's not the case in healthcare.
For sure.
But yet, we're often the last at the table for making decisions. Second, there are so many greedy entities pulling healthcare dollars and resources out of the ecosystem that what's left over are the breadcrumbs, and it's patients getting denied access to care. So companies like United Healthcare can boast another stock price raise for their
Yeah.
shareholders. And or you have doctors who essentially are getting lower hourly wages than I pay my plumber to come fix a leaky sink.
Yeah.
There's no other profession whereby we haven't even kept up with inflation. Now,
Yeah.
over the last 30 years, doctor wages have gone down 82%. Now, no one's pulling out their tiny little violin, feeling sorry for the quote poor doctor. But as someone who's run a practice, who runs a medical company, my overhead hasn't gone down 82%. The,
Exactly.
the wages I'm paying our medical assistants and operations people hasn't gone down. So it's a broken model whereby every year overhead goes up, reimbursement goes down, and yet we're asked to take care of very sick patients who need a lot of care year after year. And so we can't be complacent. If we're complacent, this system is going to crumble, and it already is.
Yeah, no. And I think you brought up such a good point too that like a lot of physicians, a lot of doctors, they're like you said, the last ones at the table, they're not necessarily the decision makers, but they're the ones who are supposed to be carrying out all of the things that those decision makers are telling them to do. And it's like, no, I should be a part of these decisions and what's going on, and like how we're evolving and how we're changing, and I should also be compensated accordingly as well. So I totally understand, and I think that the way you put that makes so much sense too, because you don't really think about it that way as like, okay, it is all of these like larger corporations and the CEOs, and they're not the ones who are seeing patients on a daily basis.
And it's a very complex issue.
Yeah.
Us physicians are as complicit in this as anybody. We gave up the power decades ago to insurance companies, and really,
Yeah.
we're not serving patients, we're serving insurance companies because they're the ones who pay our bills. I mean, it's a sad fact. Of course, every doctor tries to do best by their patients, but in the end, again, there's no other industry where the end deliverer of the service and the end receiver of the service have no say as to the exchange of money and the way in which that care and service is going to be delivered. If you don't
Yeah.
want to pay $5 for a latte, you don't have to go to that coffee shop.
Yeah.
If you don't like how it tastes, you can go somewhere else. In
Yeah.
healthcare, patients are stuck with who's in network, and they're stuck working their way through a broken system where for the doctor to keep his lights on, he has to see 40 patients a day or he literally can't
Yeah.
meet his overhead. And so it's a very, very complex issue. And, doctors, we've abdicated our seat at the table, but I'm seeing a new wave of physician entrepreneurs who are going in and trying to be part of the solution. And we need end-to-end solutions. There's a lot of fragmented, siloed healthcare that's happening these days, frankly, for the sake of money.
Yeah.
Whether it's in the medication space, supplement space, whether it's all the digital online pharmacies. Sure, these are great. They're getting patients, in some cases, life-saving or life-altering drugs to improve their quality of life. And I don't want to downplay that. But in the end, they're still not the comprehensive solutions we need. And we still just have some big issues that we have to tackle in this country with healthcare.
Yeah, I know for sure. And so for Virtue Care, do you all take insurance? I'm assuming that you do. And then also potentially, or like kind of what is the model for that?
Yeah, so our model's a little bit different in
Okay.
that we are coming in to partner with rural facilities so they can
Okay.
improve their reimbursement and collections. Right now, Taylor, there's about 700 rural hospitals that are at risk for closing in the United States.
Wow.
Now, many people listening may just say, "Well, that doesn't affect me. I don't live there. I live in Nashville, I live in Charlotte, Cincinnati." Well, imagine this scenario. If rural hospitals start closing at the pace or continue closing at the pace they're continuing, those patients ultimately are not going to seek healthcare. And I've lived in rural communities. Some will
Yeah.
not drive more than 20 minutes for healthcare.
Yeah.
So instead, they will sit, they will wait for their disease to progress. They will wait till the last minute until they're so ill, their loved one is bringing them into an emergency room. They're going to get transferred into the big city hospitals, and they're going to overwhelm the big city hospitals that are already busy enough taking care of everyone within that
Yeah.
market. And if you think this is just a conspiracy theory, you're wrong. This is happening today. It's only going to exponentially worsen. So all of us should care about rural healthcare.
For sure.
Again, part of that is economics. For however poorly doctors are being reimbursed, that's affecting rural hospitals. And especially one of the important places that we're working to expand access is in the operating rooms at these facilities through surgical procedures, because these are literally keeping the lights on at some of these
For sure.
hospitals. And so our model works where we form a partnership with the hospital. They are going to do all the billing, all the collecting, and they're going to pay us a service fee to bring in the doctors, the systems, the teams, the care pathways to ensure
Okay.
high quality care in a highly leveraged fashion. And in the end, we've created jobs that doctors have that they can work from home, they can work
Yeah.
part-time, jobs that didn't exist.
Yeah.
Patients are getting high quality specialty care that they otherwise would not receive because, again, they're not going to travel or the hospitals can't recruit full-time doctors. And then lastly, the hospitals, because of the amount of different levers they have than doctors' offices, every CAT scan, every blood test, every surgery, that equals revenue for a hospital. And that's the lifeblood just to keep the doors open. Not every hospital is off making billions of dollars. And so it's really a win for all the stakeholders, the patients, the hospitals and the communities, and our physicians. And so we're really excited and proud about the model we've created and the partnerships that are forming.
That's super, super awesome. Yeah, I definitely didn't fully understand the model. I thought it was like more of like kind of telehealth. So now that I understand it, so your team basically would travel to these rural communities of the physicians that you have. Are you all going to be focused specifically on urology, or is it going to be other professions as well?
Yeah, we are looking to scale into other specialties. We have
Yeah.
modeled this out in things like gastroenterology, ENT, neurology, oncology. And again, it's all about leverage. If you're a healthcare system and your doctor is not operating at the top of their license for 90% of their time, not only is it a waste of time, I would argue it's immoral. I mean, think about this. If you've got a limited resource that is delivering one of the most important services in our country, healthcare, and you're having them click buttons to order a medication, I mean, uh, at one hospital I've worked at, I had to click 21 buttons to document a 60% procedure or 60-second procedure. I was like, "What are you guys doing?"
Yeah.
And again, it's all started with with good intentions. Let's say the road to hell was paved with good intentions. Well,
Yeah.
it's in safety. Well, I get it, but you can't keep saying the S word as for every justification as to why you put in new changes. You've got to be ruthless about the patient physician relationship and how that looks. And we've got to really double down on creating a better patient experience. We have to really double down on making sure doctors are only doing doctor stuff. Because guess what, folks? There's not enough of us to go around. In the field of urology, they train 300 of us a year for the entire country.
Oh.
There are 1,100 job postings for urologists right now. And of those 300 docs, 95% are going to go join a major medical center or a large group because the doctors don't want to take call. They don't want to be the only doctor there. And so that 1,100 job postings is going to be about 2,500 job postings in the next 2 years. And no one's taking the jobs. No one's coming in to take them. And that's just urology. Never mind all the other specialties that are struggling, primary care. And so we can all complain that there's not enough doctors and say we got to train more. Well, guess what? That's not happening.
Yeah.
Yeah, good luck getting more money from the federal government.
Yeah.
And again, what are you going to do? You're going to insert people into a broken system. They did a survey recently of 1,000 fourth-year medical students, and 40% of them 40% have already decided they are not going to do a clinical residency program and are going to not take care of patients. In other words, they've gone through essentially 8 years of schooling between college and medical school, peeked out behind the curtain to look what doctor life looks like, and they've said, no thanks. I'm going to go work for a consulting company. I'm going to go work for pharma. I'm going to do something else, but I'm not going to be taking care of patients because it's such a broken system and it doesn't make sense. That should scare everybody who hears that.
Yeah. No, that's terrifying because who is going to be taking care of patients? Who's going to be at one point in our lives we're all going to be sick, you know? We're all it's at some point, hopefully not like chronic illness, but at some point you're going to have to see a doctor, and who's going to take care of you if 40% already, and if the system continues the way it is, I'm sure that number is going to continue to get higher. You know, it's not just going to go down on its own. It's like we have to change something.
Yeah, it's the problem is stasis. Stasis is the fancy medical term for not doing anything, not moving. And when you have stasis of blood, you get a blood clot and a heart attack and a stroke. When you have stasis of the urine, you can't go to the bathroom, you need a catheter. Well, stasis in the business of healthcare means you're also going to die and get real ill. It's just going to happen over a very slow and tedious way.
Yeah.
And the way out of that is innovation and leverage. And that's exactly what we're doing at VirtuCare is we're creating a highly leveraged model to, again, get ruthless about a doctor's time and skills. How can I impact the most number of patients without sacrificing quality? What is the best use of the, 20 plus years of training that I've had?
Yeah.
I know what it isn't. I know it's not sitting around waiting an hour for an operating room to be mopped.
Yeah.
It's not clicking buttons. It's not
Yeah.
going to another quote safety meeting and mandatory training for 2 hours.
Yeah.
It is me taking care of patients, it's educating, it's letting surgeons operate. We have to get that ruthless about our doctor's time and then creating a team around it to support it because it's the only way we're going to improve on it. The current model, it stinks for everybody. The only people who are
Yeah.
happy are the insurance companies and their shareholders. But
Definitely.
healthcare executives are stressed and struggling and burning out. Ancillary staff is the same. We know about doctors. And again, anyone who has interacted as a patient with the healthcare system, I mean, unless you have like a doctor buddy on speed dial like I do, it's not a good experience. I
Yeah.
mean, the only way I get healthcare is by reaching out to my contacts or when my family
Yeah.
members need something. But if you don't have that inside, good luck. I mean, it's just not a good system and experience for anybody.
No, I completely agree. And so basically, your physicians within VirtuCare, then they would kind of like travel around basically. So it's like, okay, we're going to this rural community in, say, Alabama, or we're going to one in Washington or wherever kind of. So they would basically act as traveling from these different facilities, correct?
Yeah, that's certainly a component of it.
Yeah.
The way our model, the foundation of it is first forming that partnership with the hospital. It's
Yeah.
coming in and saying, we're going to bring the marketing, the operations, all the pathways and systems. Then we're going to assign a remote doctor to cover that facility, and that facility is going to work through a local nurse practitioner that they end up hiring.
Okay.
So you asked, what's one solution? Well, we have to create healthcare teams. And nurse practitioners and PAs are some of the unsung heroes of healthcare who get
Definitely.
badmouthed by too many of my colleagues who want to pull the whole title and look at the letters at the end of my name BS that drives me
Yeah.
crazy and say, listen, no one's saying or agreeing that an NP who got some online degree should be going out there calling themselves doctor
Yeah.
and that they can deliver the same level of care. However, it's also arrogant to think that there aren't a number of outstanding, we call them APPs or advanced practice providers,
Yeah.
who take outstanding care of patients, who understand their role in the healthcare team, who, when well trained and supervised by physicians, can truly act as extenders and multipliers. Because until Elon figures out how to clone doctors, I'm not certain his robots are going to come in and do the job. So we've got to, again, work smarter and not harder. And so, yeah, we leverage an APP local model who becomes that friendly, familiar face in the community.
For sure.
Our doctors are working behind the scenes with them to ensure quality is never compromised. And then again, when a patient needs hands-on care, we will send surgeons to those facilities to just operate. They're not coming there to click buttons. They're not coming there to see routine office visits. They're coming there to do cases that a team that they're a part of has set up for them. It's about collaboration, it's about leverage.
That's super awesome. I love that. I know. I feel like recently, even when I've been to the doctor, I've almost always seen an NP or a PA. I've hardly seen an MD recently when I've gone to the doctor. So, like you said, if we're like decreasing to the amount of MDs that are in the field, then we need to supplement that with something, you know? So it makes sense.
Yeah, most definitely. It's a mindset shift. I mean, listen, in the ideal world, you'd have a MD parked at every community and every clinic across the country, and that would be the person you'd always see, and they'd be there
Yeah.
for your whole life. It's just not practical. You
Yeah.
know, the old school days of the small town doc who, planted his flag in some little small town USA and stayed there for 30 years and met all your healthcare needs. It's a quaint idea, but it's just not realistic.
Yeah.
Healthcare has gotten too complex. Just even in my field of urology, I can't even keep up with all the changes in my own field.
Yeah.
And that's why we have prostate cancer specialists and bladder cancer specialists and people who specialize in urinary dysfunction. So to think that a small town, even primary care doctor who's brilliant and well trained and caring is going to know urology and GI and
Yeah.
rheumatology and manage high blood pressure and diabetes and stay on top of it. while spending a lot of time with the patient and keeping the doors open, it's just not feasible. And so I'm also trying to preach practical over ideal. We can
Yeah,
argue all day over what ideal looks like, but it's just not being delivered. So
for
when
sure.
you keep hoping for the ideal, what you're really doing is choosing zero care.
Yeah.
So stop comparing the ideal to whatever innovative care models coming in that might leverage a nurse practitioner or PA, and compare it to what you're really suggesting, which is zero care. And that's something, it's a hard pill to swallow, but it's the reality. We've got to face it, and we've got to come up with solutions that we can actually deliver in a consistent, high quality way.
Awesome. I love that. I think that that's great. Let everyone know, what is the best place to find you? What is the best place to find VirtuCare online? I will also put all the links in the show notes too for easy access.
Yeah, I think the best way is just go find me on LinkedIn. I'm not aware of there being any other Joe Pazzonas, or I guess it'd be Joseph Pazona on LinkedIn. You could see daily my daily diatribes and getting up on my virtual soapbox and yelling from the heavens as to what we need to work on here. But that's the best way to keep in touch with our growth with VirtuCare. Our thoughts about the healthcare system, and I'll also encourage anyone listening, please reach out. I am always open to taking phone calls, especially if you're in healthcare, if you're looking to really grow and change something that is going to improve our system here. Love to connect with people to, see if we can provide value. Just don't jump on there and try and sell me something or say you're going to be my investment manager, because
Yeah.
I'm putting everything in my business. I don't have any cash otherwise.
I love it. That's awesome. Well, cool. Yeah, no, I'll include that in the show notes. I really, really appreciate you coming on. Thank you so much.
Thank you, Taylor. Have a great day.
Thanks.